It's fall, and for many sports fans, that means it's football season. We're a few weeks into the season, and today we welcome back Dr. Dinesh Dhanaraj, sports orthopedic surgeon with Trinity Health Mid-Atlantic Medical Group, who will discuss some of the common injuries we see during the football season and what kind of treatment plans players may face after sustaining those injuries. Welcome. So great to see you again, Dr. Dhanaraj.
Thanks for having me. Appreciate being back.
Good to see you.
Likewise.
So let's break down what injuries are most common during the NFL season. We commonly hear about ACL, MCL, and meniscus tears. Can you break down what those mean and the treatment plans around them?
Absolutely. The lower extremity, and especially the knee, is one of the most commonly injured parts of the body in NFL sports. There's tackling, there's cutting and pivoting, there's twisting. So the ligaments of the knee, which are the ACL and PCL, the main ones that help stabilize the knee, are called the cruciates, anterior and posterior. And then the LCL and the MCL are the medial collateral and the lateral collateral. They help from side to side stability. Twisting, getting tackled, deceleration, those can cause tears. And depending on the grade of the tear, grade 1 stretch, grade 2 partial tear, or grade 3 full rupture, those can require immobilization, physical therapy, or even surgery to reconstruct those. The meniscus is the cushion between the two bones, the shock absorber that allows patients and players to run without much force going through that joint. Those can tear as well. When they tear, they can be a mechanical irritant, reduce the shock absorber. Sometimes those require rest, physical therapy, and it can calm down on its own, but a lot of times those require arthroscopic surgery.
I'm familiar with that.
Yeah. It's quite common to have, but it can be treated with surgery as well. So we have good options for those type of injuries.
Oh, that's good. That's good to know.
Yeah.
So we also see shoulder injuries.
Absolutely. Yeah, shoulder, unfortunately, as well. Quarterback in this position getting hit or even tackled, dislocations, they do occur in NFL. Getting tackled and landing on that shoulder, regardless of shoulder pads, causes AC joint sprains. And you do see some repetitive injuries like rotator cuff tears and things like that. So unfortunately, the upper extremity as well is pretty commonly injured in NFL sports.
Pretty painful stuff, huh?
Absolutely. That's the nature of the sports.
I guess so. There are many injuries that can happen, including a sports hernia. Can you tell us more about those?
Sure. The sports hernia term is used, but now more commonly known as a core muscle injury as well. So it's a muscle group that is attaching from the upper thigh and the abdominal musculature. And where it attaches to a ligament, it can tear. It's not your typical hernia, like an inguinal hernia where you have a problem with, sometimes even bowel and issues like that, herniating. It's more of a muscle injury. It can be a source of pain. Linemen, people who are in three-point stance and trying to kind of blow out of that position quickly, they can have these injuries.
Does that require
surgery? And it does require surgery most of the time.
Wow.
Yeah.
Since we're covering the full body, foot and ankle injuries also commonly happen. What can you tell us about what happened with Aaron Rodgers with his Achilles rupture? What was the recovery like for an injury like that?
Sure, yeah. Very interesting injury and kind of well watched. It was the first play or it was the first game of the season, and went out and he planted and he might have gotten loaded in a certain position where his Achilles ruptured. Couldn't walk on it. He knew he was out. So that requires surgery. Not all the time does it require surgery, but in that level of athlete, it's usually best treated with surgery. It's an interesting surgery. Back in the day, we used to sew the tendon back together on both ends and tie big knots, and that suture kind of can cause issues. Now we do it minimally invasively, and he had that done through small incisions where they can suture it proximally in the tendon and then pull it down and put in anchors, and they can do this through a small incision. So the recovery is remarkably faster. I've seen videos of people doing like box jumps at 6-8 weeks out after surgery,
really?
Which is a little bit extreme. But if you look at the timeline for Aaron Rodgers, he was throwing that football pretty quickly after that injury. So
do they get re-injured with those?
Hopefully not. It's less of a rate of re-rupture with surgical intervention than leaving it in treating it non-operatively. So that's the goal, is to kind of keep him on the field and keep him on the field as long as possible. But it does require some lengthy rehab. We've seen people in NFL, in NBA, and those type of levels take 8 to 9 months, and sometimes it's career ending. But in Aaron Rodgers' situation, I'm excited to see this season, see how he moves on that thing.
Yeah, I think we all are.
I know. Yeah, we need.
Okay, how about concussions? Can you explain what exactly happens to the brain during a concussion?
Sure. A concussion itself is a brain injury caused by a direct blow to the head. And that can be from impact to the ground, that can be from an impact from another player. But the brain itself within the skull actually takes kind of a direct blow as it shakes back and forth. You have a coup and a contra coup as it can kind of accelerate and decelerate. It can result in a loss of consciousness, but not necessarily all the time. But players can have mental effects from that, whether it be getting up slow, being disorientated, nauseous, or confused. We take it very seriously now, and nowadays there'll be a quick sideline assessment, and if there's any suspicion for a concussion, a patient or a player, will be taken off the field. We've seen some long-term, deleterious effects from traumatic and repetitive concussions, such as CTE, known as chronic traumatic encephalopathy. It can be a lifelong condition that causes dramatic problems down the line, dementia, early onset death, things like that, and even behavioral issues. So we take concussions very seriously, and we have a lot of good kind of preventative measures nowadays to help, keep them from happening.
I know they realize today how serious they are.
Absolutely.
So based on your experience, what common misconceptions do people have about concussions?
Well, I think back in the day, you kind of just shake it off and get back into the field, and you kind of just assess the player and say, hey, how are you feeling? Okay. Nowadays, even on the high school sidelines that I cover, we really take it seriously. If the player is acting it all off, regardless if we don't see a huge injury pattern, we want to rest that player. The brain is the most important part of the body. We have to keep it safe. So we take it very seriously, and we don't, kind of let them back on the field or just shake it off like we may have in the past.
Right. What are some long-term effects of repeated concussions, especially for athletes?
Sure. The big one is the CTE, which is the traumatic encephalopathy that can occur with repetitive and long-term concussions. So early onset dementia, things like that. We used to call it pugilist disease. Somebody who got boxed and hit in the head often would have long-term sequelae, confusion, even sort of behavioral issues you've seen with long-term repetitive concussions. So we take it seriously. It can cause a lot of even premature death.
Yeah.
So
serious.
Yeah.
What measures can be taken to prevent concussions in high contact sports?
Yeah, the equipment is huge. The equipment has come such a long way. They have almost nowadays in the NFL helmets, same kind of things that you would see in your cell phones in terms of like gyroscopes and sensors. So they can tell acceleration, deceleration at certain levels in these helmets nowadays.
Amazing.
Yeah,
I didn't know that.
it's getting there. I don't know if it's totally widely implemented, but I saw that they were going towards that to kind of know, did that player take a large blow to the helmet? They have the technology now to see that. So that's safety mechanisms in terms of technology. You'll see in preseason, they wrap their helmet with a big bubble wrap looking thing. So it reduces the amount of blows these players are taking preseason and even in practice.
That's a good thing.
Yeah, it's a good thing. They really take it seriously. There's so many measures now, which is, it's a lot about safety.
Well, I hope there's not too many injuries, but I know they'll be in good hands if they do.
Yeah.
So thank you so much for sharing this information with us and and updating us on it.
My
we
pleasure.
really appreciate having
Always
you
fun.
here.
Looking forward
Good
to the
to see you
football
again.
season. Likewise.
Thank you, Dr. Dhanaraj, for joining us today. We broke down a lot of injuries sports commentators typically discuss, and hopefully you now have a general idea of the injuries being talked about during this NFL season. For our Philadelphia sports fans, keep an eye out on the Philly Voice Injury Report, where Dr. Dhanaraj and other orthopedic surgeons around Trinity Health Mid-Atlantic Medical Group will weigh in on sports injuries this season. Thank you so much for joining us. We'll see you the next time on Beyond the Stethoscope.